I would next like to invite Evan Fry to come up and introduce his team. Evan he really distinguished himself as an intern. He is one of the very few sophomores that we allowed into the program as a first semester sophomore as an intern. And he has done more projects than any intern, besides the staff, really. He has done more projects. He was a normal intern last fall semester with the ICCEW team. He then stuck around and was on the Apple iPad team. Then over the summer, he was part of our inaugural class in Livermore, California, and now here he is as a team leader. And he has been a tremendous joy to just watch grow and mature and really come into his leadership role as part of this program. So with that, I'll hand it over to Evan.
Thank you very much, Val. The team is really excited to present the results of their recommendations that they've been making over the semester, and I'm incredibly proud of all the work that they've done. Working on a social entrepreneurship project has been really special because not only are we looking to promote economic development in the state of Oklahoma, but we're also looking to enact fundamental quality of life changes in people. And in our case, people half the world away. And the team has really gotten caught up in the results of working on that this semester. We've had a lot of great learning experiences that we've been able to do. We've had to get up at 6 in the morning to make calls to ophthalmologists that are across the nation. We've gone to an ophthalmology conference and hustled with medical device manufacturers there. And the team has really risen to the challenge of all the things that we've had to work on this semester. They've come around the larger problems that we were working on, and they've come together and put together a very impactful recommendation. So I don't want to keep them waiting in the wings any longer. So it's my pleasure to introduce Charlotte, Rebecca, Dan, and Tyler of the International I-CCEW team.
Good evening. In China, more than 5 million individuals will go blind. Sorry, you probably want to know who we are. But in China, more than 5 million individuals go blind each year. That's more than the entire population of the state of Oklahoma. In most cases, this blindness is preventable. Building off of I-China, a past I-CCEW project, my teammates and I have developed a plan to reduce preventable blindness in China through creating the International Eye Institute, or IEI as we like to call it. IEI is a for-profit company that will partner with local Chinese hospitals to establish joint venture eye institutes across the country. Now, in November, the Dean McGee Eye Institute in Oklahoma City welcomed a delegation of officials from the Sichuan Provincial People's Hospital, SPPH, which is a public hospital in Southwest China. They welcomed these officials to begin negotiations on IEI's first joint venture eye institute, SPEI, the Sichuan Provincial Eye Institute. My teammates and I developed a business plan that drove negotiations at this meeting. And the two partners agreed on a model that would bring international recognition to DMEI and OU, as well as create a network of ophthalmic centers of excellence across China. My teammates and I are really excited to share with you the plan for SPEI, but first we'd like to introduce ourselves. I'm Charlotte Lunday. I'm a senior meteorology major from Springfield, Missouri.
I'm Rebecca Stevenson. I'm an economics senior from Portland, Maine.
Dan Phillips, economics junior, St. Louis.
Tyler Pearson, I'm a law student from Pryor, Oklahoma.
Our inventor is Dr. Lloyd Hildebrand from the Dean McGee Eye Institute. Our mentor is Dr. William Paiva from the Oklahoma Life Sciences Fund, and our team leader is Evan Fry. Now, the Dean McGee Eye Institute and the Sichuan Provincial People's Hospital, they make optimal partners for enacting widespread improvements in ophthalmic care in Southwest China. DMEI is a leading eye institute in Oklahoma City whose surgeons and researchers are recognized internationally. SPPH is the second largest provider of ophthalmic care in Southwest China, and they also house the national government's local blindness prevention efforts. These two partners have built a relationship over the past 12 years. They've built a relationship over the past 12 years as DMEI surgeons have participated in short annual medical exchanges, sending sorry, at SPPH. It's dry up here. More recently, however, these two partners have begun to take steps to increase their impact in the region by forming SPEI, which is IEI's first joint venture eye institute. Now, at the delegation meeting in November that I mentioned, the two partners agreed on 3 goals that SPEI should accomplish. The first is to increase the surgical expertise of local ophthalmologists, improve the quality of the patient experience overall, and then revolutionize the medical education system. These 3 goals came about on the basis of observations the two partners have had throughout their time working together over the past 12 years. The first is a lack of surgical expertise. Because Chinese surgeons often do not operate using the most advanced techniques or technologies, patients with complicated cases often do not receive an adequate level of care. Care is further diminished by an overwhelming demand on the system, where patients will frequently go to hospitals and wait up to 6 hours for only 5 minutes with their doctors. These problems stem in part from an underdeveloped education system in which Chinese ophthalmic residency programs takes 2 to 3 times longer than US residency programs. And upon completion, the Chinese ophthalmic residents have not received enough surgical experience to effectively operate independently. At the delegation meeting in November, my team and I created the mission statement for SPEI to reflect the overall goals that the partners agreed on. They want to accomplish these goals so that SPEI can reach the root causes of those problems that we just talked about. But accomplishing these goals will take capitalizing off of the assets of both partners. First, SPEI's success will depend on Chinese ophthalmologists from SPPH working together with internationally acclaimed subspecialists and DMEI's networks. Together, these surgeons will provide an unparalleled level of care in the region. Secondly, SPEI will leverage SPPH's position as a well-recognized provincial hospital and implement DMEI's best practices management system, and thereby improve the efficiency of care and therefore the overall patient experience. Finally, SPEI will take doctors trained at SPPH's medical school and train them on a robust residency curriculum developed by DMEI that emphasizes surgical expertise development. By doing so, SPEI will have a platform on which to train a greater number of ophthalmologists to provide much-needed eye care in the region. Accomplishing these 3 goals will allow SPEI to be successful in Southwest China. My teammate Rebecca will now describe more specifically the environment in which SPEI will operate.
Thank you. So as Charlotte just mentioned, our first hospital will be SPEI, and it will be able to effect ophthalmic care throughout southwestern China. Its initial area of impact will be Sichuan Province and Chongqing Municipality, and it will be strategically located in Chengdu, the capital city of Sichuan. Now, this region is an area of 109 million people, 7 million of which will develop an eye disease every year. Of these people, 920,000 have access to Chengdu and represent SPEI's addressable market. Of these 920,000, 33,000 cases will develop among high-income individuals. This is a segment of the market which SPPH is yet unsuccessful in reaching, and which represents a $53 million annual market. Now, these people are wealthy Chinese families, non-resident Chinese, and expatriates living in the area. They are very attracted to the international brand which SPEI can offer and are willing to pay a premium for our services. By targeting this market initially, SPEI will attract investment and develop a reputation for excellence. This will allow our institute to build capacities of ophthalmic care throughout Southwest China, which will then allow us to expand into the middle and lower income markets of Chengdu. We will do this through a tiered pricing model. These individuals represent a $740 million total potential market every year. Now, in order to effectively reach both of these markets, SPEI will concentrate on 3 aspects of its operations. We will have unparalleled quality of care throughout Southwest China. We will use efficient management systems, and throughout all, we will concentrate on building capacity and sustainability through education. First, let's look at the quality of our care. Care at SPEI will be offered through a paired surgeon model. As agreed upon at our delegation in November, the paired surgeon model will consist of permanent Chinese surgeons coming from a transfer from SPPH, as well as international subspecialist experts who will travel to Chengdu for 2 weeks at a time to perform surgeries in tandem with these Chinese surgeons. Now, these surgeons will be recruited from Dean McGee Institute, as well as its partner institution, Kaiser Permanente. In addition to this, my team and I have recently traveled to Chicago to work with the Global Alliances Office at the American Academy of Ophthalmology. This has been to increase awareness and interest in SPEI in the international ophthalmic community. Now, these paired surgeon teams will be able to expand the service offerings throughout Southwest China by leveraging the knowledge of these international experts, as well as by facilitating skills transfer between countries. This method of implementing care at SPEI will be overseen by an international management team, chosen jointly by SPPH and DMEI. Together, this team will ensure that best management practices are used at our hospital. This will include operational management systems as well as administrative technologies. Now, as Charlotte mentioned earlier, there is currently no appointment system for hospitals in Southwestern China, meaning that patients can wait up to 6 hours before seeing a doctor. It's a very long time. So, by instituting appointment systems and lane management, SPEI can systemize patient flow, facilitate task delegation, and ultimately see a greater number of patients. In addition, our management team will use electronic health record systems and management software. This will increase access to information for both domestic and international surgeons, as well as reducing administrative overhead. This is by simplifying organizational methods of medical records and billing. Lastly, throughout all of our systems, SPEI will concentrate on capacity building and sustainability of its programs through education. This will first involve training SPPH doctors. They will go through our certification program, increasing their subspecialty knowledge, as well as ensuring that they provide an international quality of care as SPEI's new employee base. We will also train the next generation of Chinese surgeons by drawing Chinese medical students through our residency program. This will be a very standardized 3-year curriculum, which will produce independent surgeons upon completion with a very broad depth of ophthalmic knowledge. SPEI will incorporate these surgeons as it expands to see more patients and to build capacity of ophthalmic care throughout Southwestern China. Dan will now tell you how this model that you've just seen fits into the existing market.
Thanks. Based upon the operational model Rebecca just presented, SPEI will be able to deliver high levels of surgical expertise, quality patient experiences, hold a strong reputation, and do it all at a mid-range price, allowing it to compete successfully. It's going to face competition from a few main groups, however, one of which is local public hospitals such as SPPH. Because of their emphasis on achieving volume and caseload, these hospitals lack high levels of surgical expertise and patient-centric philosophies, but they have low costs and good reputations. A partnership with DMEI would be able to turn these weaknesses into strengths. A second group is local private hospitals. Because of their smaller volumes, they deliver high levels of care, but they have limited reputations. Some wealthy Chinese choose to travel to private elite coastal clinics for care. And these clinics deliver very high levels of care, but they do so at a very high cost to the consumer, charging 7 times what a public hospital would. By providing the same level of care, but at a mid-range price, SPEI will be able to compete successfully. So we've talked up till now a lot about what SPEI is going to look like, and I want to transition now to implementation. SPEI is going to meet its goals through a 2-phase implementation program. This means starting with a proof of concept, during which the model is operated in miniature, before moving to phase 2, the independent institute we've been talking about up until now. And there are 3 main benefits to doing it this way. It requires a smaller initial investment, it's a chance to test and refine the model, and it involves reduced risk. One of the pioneers of this 2-phase implementation plan is the Texas-based International Spine and Orthopedic Institute, or ISOI. And what ISOI is focused on doing is taking the Western model for spine and orthopedic care and applying it in China through medical joint ventures. I-CCEW just completed a successful proof of concept that launched in March of 2011 and is currently moving forward with building an independent institute and has already raised $16 million for this effort. Clearly, two-phase implementation works. However, prior to starting the proof of concept, I-CCEW spent 3 years cultivating the relationship between the Texas Back Institute, which is I-CCEW's version of the Dean McGee Eye Institute, and the first affiliated public hospital of Suzhou University, which is I-CCEW's public Chinese partner hospital. We talked to the CEO of I-CCEW on the phone, and he was very impressed with the length of the relationship between DMEI and SPPH, and he commented that in some ways, DMEI and SPPH are even more prepared and even more ready to move forward with the proof of concept than I-CCEW was 2 years ago. So not only does the proof of concept phase work, DMEI and SPPH are ready to take the next step and move forward with it. So applying this all to SPEI. Phase 1 will be an international wing within SPPH. It will operate as a subset of the total SPPH Department of Ophthalmology, do about 1,500 surgeries a year, and it will last for 2 years, similar to what I-CCEW did. And as agreed upon in the negotiations in November, funding for this phase will be provided by SPPH. SPPH will do this in return for all profit at this phase, and we anticipate that SPPH will actually be able to break even on its initial investment within the two-phase window of Phase 1. Phase 2 depends upon the success of Phase 1. Before transitioning to Phase 2, there are 2 main criteria that must be met. Residency programs must have begun, and there must be a clear schedule of rotating subspecialists established. Now, once these 2 goals are met, SPEI will move forward with Phase 2, which is the independent institute that we've been talking about up until this point. This is what the IEI team will be presenting to SPPH leadership in May during DMEI's annual visit to Sichuan province. Phase 2 will be a standalone facility. It will have its own new building on its own physical ground. It will be the new Department of Ophthalmology for SPPH, and at max capacity, it will do 5,000 surgeries a year. Funding for this phase will come from SPPH and also from investors, and these investor funds will be funneled to SPEI through IEI. So to sum up, SPEI will use a 2-phase implementation plan to get to where it needs to be to deliver care to Southwestern China. Here now to put some numbers behind all of this is Tyler.
Now, throughout the course of this semester, our team has been very busy to build a dynamic financial model so that we can recognize what the pro forma will look like for both facilities. And right now, both the Phase 1 and Phase 2 will reach profitability. So let's start with Phase 1. In 2013, we will begin Phase 1. It will cost $650,000. Now, our pricing will be based on a 2x multiplier for current SPPH pricing within our facility. That multiplier that was decided upon in the delegation meetings held in Oklahoma City will allow the Phase 1 proof of concept facility to break even in the 4th quarter of 2014. Also in 2014, we will break ground and begin construction on the standalone facility. Now, this is a little bit more expensive. This will cost about $5 million, but this will cover our OR costs, our exam lane costs, and also our renovation costs for the hospital. In 2015, we will open the doors for the standalone facility. We will grow from a patient caseload of 2,500 surgeries to 5,000 in just 5 years. Also, considering that 2x multiplier on current SPPH pricing, we will break even in the 1st quarter of 2018. Now, this is an extremely quick payback period for projects such as a hospital. How do we get that $5 million? Well, right now, we have our partners, SPPH and the D. McGee Eye Institute, and they are both bringing their intellectual capital, their non-cash assets, such as their expertise and their relationships in the industry. But we still need cash, so SPPH will bring $2.5 million. U.S. investors will also bring $2.5 million. These U.S. investors will be comprised of dedicated funds and also investor surgeons. Along with the D. McGee Eye Institute, these 2 partners will create the International Eye Institute. Now, IEI will be the entity that creates these partnership hospitals throughout China. And our first one, of course, will be SPEI in Chengdu. And as we prove that concept, we will expand to new markets such as Kunming and Xi'an. You've seen our financial results based on an 8-year time horizon with a multiple in that 8th year. We will achieve a return on investment of 400%. But this is not just a financial project. We will also have a global impact for social reasons as well. Patient care will reach 60,000 surgeries in that 8-year time period. Also, we will educate 45 new subspecialists in that 8-year time period, and that's a big problem in China with the capacity issues that they're currently experiencing. In November of this year, we hosted a delegation from SPPH here in Oklahoma City at the D. McGee Eye Institute. At that meeting, both parties agreed to establish the SPEI facility. Well, since that meeting, we've been busy, and we've been working with D. McGee to make a budget for the SPEI and also to implement the different strategies that we want to achieve. SPPH, on the other hand, has sent their delegates back to China, and they've been working to secure funding as well as to gain approval from the hospital president. In the summer of 2013, Dean McGee will send a delegation to China, as well as with ICCEW going to China, and hopefully we will develop a legal agreement. After that legal agreement is achieved, we will recruit subspecialists here in the United States to go back over to China and serve. We will also pick a management team to oversee the operations of the SPEI. While that is going on here, SPPH will be readying the facility at the SPPH facility in Chengdu. Also, they will be beginning a large marketing campaign throughout the province to generate support for the fall opening in 2013. Now, throughout this semester, our team has been very fortunate. We've had the opportunity to see a live cataract surgery. We've gone to the AAO conference meeting in Chicago and met with some of the best and brightest in the eye care industry. In just 2 days after getting back from Chicago, we were hosting a delegation at Dean McGee. And in that negotiation, we were an integral part, and we were helping them facilitate both sides to reach that agreement and make this SPEI facility a reality. Now we hope when we get to go over to China in the summer of 2013 that we will finalize that agreement that suffer from eye diseases. This concludes our presentation. We will now take questions. Thank you.